Former Deputy Health Minister Dr. Lee Boon Chye and CEO of the Centre for Market Education, Carmelo Ferlito, called on Putrajaya to draw up a clear game plan to address the COVID-19 situation in the long term. They said the country could not afford to keep going through lockdowns as they were costly for businesses, employers, and workers. Lee told FMT that the government needed to speed up the vaccine rollout and to boost public health measures like contact tracing and mass testing. You could reopen the economy within 2 weeks if you locked down an area, did the contact tracing, quarantined people within 48 hours, and carried out mass testing. Lee said he believed the government was now too reliant on movement control orders, which were costly and inefficient, and called for proactive measures to be put in place. We need to have clearer direction as to how we are going to get out of this mess, he said. It's not good enough to just have an MCO and hope cases will go down. Ferlito said there appeared to be no exit strategy, and alleged that the authorities had underestimated the risk of rising infections after the first 2 lockdowns. We need a clear medical strategy to cope with the possibility of cases rising without having to resort to yet another damaging MCO, which has severe effects on the economy and the livelihood and mental health of the people. He said he was not surprised by reports that hospitals and frontliners were at breaking point. The question is, have we done enough to boost our capacity to treat people? Other countries have invested in temporary hospitals. Ferlito said the government could introduce a temporary tax to support COVID-19 measures if funding was an issue, which he believed businesses would support provided they were given an assurance that they could operate as normally as possible. He also said that the government should allow the private sector to procure vaccines and cut red tape to encourage investments in private medical facilities to improve treatment capacities.